Now, this is a very interesting MRI of the brain. You can simply pause the video and you can try to find out the problem, whatever you can find. So, we must know that this is definitely MRI brain because the anatomy of the brain is very, very beautifully and crystal clearly seen. This is T1 MRI. We know the T1 versus T2. We know that the gray matter, which consists of the neuronal bodies, they appear gray, and the white matter, if it appears white, we say that it is a T1 weighted image. So if you see the outer portion, this is all the neuronal or gray matter, which is placed in outside portion, and this is all white. It means that this is all white matter. So this is white matter and it appears white, and the outer portion is or gray matter which appears gray. So this is T1 weighted image. The second important thing is that we must come to know that this is not only T1 weighted image, but this is post contrast image, because we can see presence of contrast in the different arteries of the brain. So this is all contrast. This all hyper or increased signal or hyper dense or dense white structure is all contrast, because contrast will appear in all the blood vessels. So this is all contrast which we can see. So this is contrast, post contrast image. This is T1 image. So why do we give contrast is to basically see whether there is any enhancement of the structure after giving contrast, or if there is diffuse meningeal enhancement, so we can see the meningitis. Second thing, we can see whether there is any tumor or abscess or any lesion which shows enhancement, which may suggest either inflammation or malignancy. So whenever there is increased blood flow to any structure, there will be enhancement of the structure after giving contrast. So very commonly abscesses, inflammation, vasculitis, meningitis, and a malignancy which has increased blood flow will get enhanced after giving contrast. So you can simply see pre-contrast image and you can compare it with post-contrast image. You can see there is wide variation and any structure will get lightened up after giving contrast. So in this image, what we can see is there are so many small lesions which are showing enhancement like this. We can see that there is a round structure with significant enhancement. We can see there is so much of whitishness or increased contrast uptake by this particular lesion. We can see this particular lesion. So this is appearing so dense white. This is getting enhanced after giving contrast. You can see this, there is this ring enhancement. This is all enhancement. This is all enhanced lesion because it is not a normal part. It is not a normal component. This is also, there is marked enhancement of the structure. So there are so many numerous lesions which we can see, which here you can see there is this one ring type lesion which is getting enhanced. There is one lesion here. This is not a typical ring or granuloma, but this appears that there is some heterogeneous lesion. You can see there is blackishness in between and there is enhancement around this. So there is a heterogeneous structure or lesion which is showing enhancement after giving contrast. So there are so many lesions in this MRI. You can see this is one, uh, this is, we have seen already so many, like this is two, this is three, this is four, this is five, this is fifth basically, uh, this is sixth in this temporal lobe, this is seventh here, this is eighth in the right temporal, this and this lesion is same. So there are so many lesions, that too in different part of the cerebral cortex. So whenever it is involving multiple parts of the cerebral cortex, it can be NCC, that is neurocysticercosis, it can be tuberculoma, or it can be metastasis. These are the most important possibilities, either NCC, that is neurocystic or tuberculoma, or metastases. Now, to call it as NCC, we know that NCC, most of the time there will be numerous lesions. If it is NCC, there will be numerous lesions. There can be n number of lesions. It may show starry sky appearance. Most of the lesion will be less than 2 centimeter. There will not be much edema. So edema you won't see much in neurocystic. And very commonly you will see this granuloma or calcified lesions. So this will appear more of a calcified granuloma lesions, and that can be present in all over the brain parenchyma. And there can be ring forms also, or there can be scolex form also, like this with eccentric dot, which is called scolex form. So this type of thing can be seen with NCC. Uh, but most of the time, all these lesions will be of around similar sizes. There won't be much variation in the size if it is NCC. When it is tuberculoma, very commonly what we see is the tuberculoma lesions can be more than 2 centimeter. They may show marked edema, and they may conglomerate. So they may coalesce or conglomerate to form a large lesion. These are very commonly more than 2 centimeter, and there can be marked edema, and you can see the contrast enhancement around this lesion. And the third in is malignancy. We always suspect malignancy in any elderly patient and who should have some primary somewhere else. And in malignancy, the lesions may totally differ in size. And in this particular image, this MRI brain is showing so much of variation in involvement, and there is not only this lesion is showing marked edema. Otherwise the other lesions, they are not showing that much of marked edema, but there is significant variation in the sizes. This particular patient has CA lung and with this mets. So this can be tuberculoma, but whenever we suspect a malignancy and with this type of lesion, this is almost always malignancy. This patient had no symptom. This patient presented with focal seizure. We did MRI and we found this thing. Whereas if it is tuberculoma, then patient can very commonly have headache, convulsions, altered mental status, confusion, convulsions. These are very commonly found symptoms, because tuberculoma, that too in this much of extended involvement of the parenchyma, can be really, really, really bad. One thing I want to show, we can see the presence of edema around the lesion. Just see this part. So we know that this is all white matter. This is in the middle of the brain. This is all white matter. Just compare the white matter of this left side to this right side. So we know that the lesion is here because this is showing enhancement. But around this lesion, what we can see is reduced signal or hypo intensity or reduced signal. This is all blackishness, which should not be there because this is all white matter. This is all white matter, though there should not be any whitishness, blackishness. Blackishness or reduced signal can be seen only in two things. One, if it is edema, or second, if there is an infarct or ischemic changes. So in this patient, there is no reason why the patient should have ischemic changes, or we are not suspecting any stroke. And this patient has this lesion, and that is the reason why this is showing marked edema around this particular lesion. So this patient had CA lung with significant multiple brain metastases showing marked edema and multiple varying sizes lesions with significant post contrast enhancement, highly suggestive of metastasis. That's all for today, and thank you.